if we have a great hospitality, if we listen to our guests, if we help to serve the right portion at the right time and give them the right sleep or advice on how to do so, we would have much better quality time. And I think this is what we really want, is to have like thriving people, not just surviving people. We want people to live and thrive, not only survive. And giving them the guidance, but we're not always good at it, and we sometimes scare people so much off that they run away.
Let's use their weapons, right? Let's use the same strategies that are backed by science to inform people the best way, right? And let's make them copy behaviors, right? So if I know that my neighbor is getting vaccinated, I am more willing to get vaccinated because I trust the neighbor.
Future Hacker. Life. Path. Future.
Hello, everybody, and welcome to Future Hacker. I'm your host, Maria Taiji, and today we have an important and relevant discussion lined up. Health literacy. In a world where information is abundant, understanding and using that information to make informed health decisions is critical. But what exactly is health literacy? And why is it so important for individual businesses and governments? So to help us explore this, we have two brilliant guests today. Kristine Sørensen, the award-winning founder of the Global Health Literacy Academy. Kristine is a leader in strategic health literacy, helping shape policies across industries, academia, and governments all over the world. She's also published extensively on this subject and co-edited the International Handbook of Health Literacy. Hello, Kristine. It's great to have you with us today. How are you doing?
I'm fine, thank you. Calling in from Denmark, and it's such a nice opportunity to meet you and Raquel.
Awesome. So, joining her is Dr. Raquel Ajub Moyses. She's a medical doctor specialized in head and neck surgery with a PhD in molecular cancer biology and a master's in clinical effectiveness from Harvard. She's the founder of Curar Saúde, a social impact startup, a member of the Health Literacy Network in Brazil, and she's deeply involved in advancing health literacy in Brazil. Hi, Raquel. How are you doing? Thank you so much for joining us today.
Hello, Maria. Hello, Professor Kristine. It's a great honor to be here for me. Thank you so much.
It's such an important discussion that I was willing to do in a while ago. So, let's begin. Kristine, you've built this incredible global career in health literacy, right? So what initially sparked your interest in this field?
I think I've always been interested in the global world. Some are born with roots, others with wings, and I guess I got the wings. So I love traveling. I try to visit a new country every year. I've been to Brazil some years ago, but only for a short time, visiting a conference in Curitiba. So I would love to come again one day. But my background is in medicine and public health science. And while studying medicine, I realized that I was actually much more interested in how we could keep people healthy and not only treat them when they're ill and come to the hospital and our primary health services. And that got me into a very long journey that is now, having me here talking about health literacy.
Great. And I can't wait to hear some examples that you're going to be able to give us from all those countries that you've been around. Raquel, and you yourself built this career that spans surgery and teaching and leading a health literacy startup, right? So what's inspired you to expand your focus from clinical practice to also include public health and health literacy?
Well, I think they're very interconnected. I love to take care of people. I love to operate my patients and take care of them. But after my PhD, and I had this dream of somehow improving people with cancer's life. through molecular biology and discoveries and high-end technology. But when I started working as a attending surgeon at Hospital das Clínicas, and for those who know, Hospital das Clínicas is the largest public hospital in Latin America, my perspective kind of shifted because week after week, I found myself increasingly frustrated. Like, I was seeing patients with so advanced cancers that they were arriving too late to be treated. And it was not only for me, also my friends in other areas. Like, they were seeing patients that were arriving with blind from diabetes, and they just realized they had diabetes. So they discovered their diabetes when they had already lost their kidney function and so on. So I started to question myself. So, okay, we are doing this great work as a surgeon, but how many people will actually have access to that? And they were dying from preventable diseases in preventable ways. So I decided to pursue a master in public health for this reason. So how do education, motivation, systems, how are they interconnected in a way that we are producing so bad results? And that's why I decided if I wanted to do something more than what I've learned as a surgeon, I would have to understand it better. Then I faced the concept of health literacy, and I usually get to know that physicians or all health practitioners, when they get to know health literacy in life, they don't know, they just recognize the issue. So it's something that suddenly they put a name on something and organize a very complex problem in a very actionable way to deal. So there's a lot of people worldwide and starting more recently in Brazil to trying to decode the problem, like break into small pieces and try to action on that. And I'm benefiting from those researchers and trying to do some research myself.
Yeah, so I see a big common ground in there, which is to avoid people, do something before it's just too late for people here. Before we dig deeper into this topic, let's try to put our listeners on the same level here. Kristine, could you explain what health literacy is like in its simplest terms, right? And how is it different from just being informed about health?
I think Raquel really shed light on it. It's something we actually can call common sense in a way. It's the health knowledge and motivation and competencies you have to explore your own health and keep yourself healthy. We can explain it as the outcome of health education, and not only the education you get at school, but also what you learn at home and what the society is telling you, what the politicians are telling you. So we're influenced by a lot of health knowledge from the media, from authorities, from our family, from what our parents do, and what we want to do. And we are faced also with information throughout our lives. We learn how to brush our teeth in kindergarten. You learn to stay active in schools. You learn about maybe smoking and alcohol while you're a teenager. And when you're adults, you learn how to avoid stress. And eventually, as an old person, you learn how to live healthy. So it changes throughout our lives. But we can describe it as an outcome of this kind of formal and informal education. So it's not only the knowledge, what we know.
But adding to that, you have this concept that you call health literacy by design. So what do you mean by that?
Yeah. So we all know that it's not necessarily that we all learn what to do in the right way in schools and from our families and our communities. So I believe it's not an individual responsibility alone. Surely we can do something on our own, and we can commit ourselves to have a healthy mind and a healthy body. But we also face with barriers that are constructed in as part of access to health, about political standards, about our resources, and this is where health literacy by design comes into the place. What can we do, coming from a system perspective, being health providers and doctors like Raquel, being a researcher and a consultant myself, or a decision maker or a business manager? What can we do to keep people healthy at work and in society in general? And health literacy by design is a framework where we focus on how to make better health information that is easier to understand, how to design user-friendly products, how to create services where people understand you in languages that you understand and that take into account your personal preferences and ethnicity and religious and some personal beliefs. How do we make sure that health literacy is an integrated value in organizations? So from a management point of view, you can design the organization to be much more responsive to people's health and demands and create services in a timely fashion. And lastly, how do we make sure we really uh, don't do just health one size fits all, but really people centered, person centered services? And these are all design issues. It's something that we can influence, it's something we can create, and so that we ensure that conditions are really enabling people to manage the health in the best possible way.
Yes, I love that. So basically, it's how you can bridge this knowledge into action, right? And Dr. Raquel, this is something that we've discussed a lot offline, right? And I have two questions for you, Raquel. So one is, if there's anything you'd like to add to what Kristine already said, but besides that, what are your thoughts on how we can actually encourage people to move beyond just knowing to doing?
Yeah, great. So I couldn't add anything more sophisticated from what to what Kristine said. But I usually try to, sometimes when I'm trying to convince people about what's health literacy, I don't have the time and the patience of the audience to understand the concept. So I usually use some kind of analogies. And one analogy that I usually do is that um, imagine that you already know that trans fat is bad for your health. That is knowledge, right? But health literacy is more about competence than only knowledge. So competence, we would add to this equation not only knowledge but also ability. So what is your ability to read the food label, right? And to detect that there is trans fat over there, or it is very high in fat, low in protein, and so on and so forth. And then competence also acknowledges attitudes. So, okay, I do know that trans fat is bad. I can read a food label, but will I actually change my mind in terms of what product will I buy or will I consume based on this food label, so in this composition? So it's the triple concept of competence. It's knowledge, it is attitude, it's ability, sorry, and it's attitude. So sometimes I usually say if only knowledge was necessary, we wouldn't have physicians smoking, right? I have colleagues from my area, and we do face a lot of problems from cigarette smoking, and they started to smoke during the residence. So that's not only knowledge for sure, right?
How do you see the impact here, and how do you think we could be encouraging people, right? Because as you just mentioned, like so they have the knowledge, they have the capacity to understand it, they don't have the will, right? So how do you see that?
Yeah, I like to see the intersection from that we have with health literacy and behavior, like behavioral science. And our motivation is very complex to understand. It depends on a lot of things like social pressure and peer pressure, for the good and for the bad, right? And we also have like perceived benefit. And when you're facing scarcity environments, so it can be in terms of time, it can be in terms of money, it can be in terms of access. It is a little bit harder to make options that the benefit is very is too much in the future. So we try to make options that can give us the immediate reward, right? So and there are other factors that can influence behavior, and that's why sometimes knowledge doesn't transform into action. So I like the way some researchers are now trying to understand how behavioral science and health literacy can work together, and to like bridge that final mile of the health literacy, which is getting to action properly.
I first started to learn about health literacy with Dr. Raquel, and I fell in love into that. And I see such a perfect wedding when we put behavior science into the math here. Kristine, would you like to add anything to Raquel's thoughts, and around also if you're seeing techniques of behavior science being involved when dealing with health literacy around the world?
Maybe I can share a short story, because very often it's not learning by knowing, but learning by doing.
Yes.
And I guess you know the bedside story about Goldilocks and the three bears. And Goldilocks come into the forest and finds this little house with that is empty, and she sees the porridge on the table and tastes the Papa Bear's porridge. It's too hot, and Mama Bear's porridge is too cold, and eventually she likes and loves the baby bear's porridge. Then she tries the chair, same thing happened. Papa Bear's chair is too big, Mama Bear's chair is too small, and she likes the baby chair. And going to bed, the same thing happened. The Papa Bear's bed is too big, Mama Bear's bed is too small, and then she falls asleep in the baby bear's bed. So when the bears come home, they realize Goldilocks is sleeping there, and unfortunately she wakes up and she screams and she runs away. But taking that analogy to the healthcare system today, very often we give a bed that is too big or a porridge that is too cold. We don't always listen to the needs and cater for the visitor we have in our healthcare system, and sometimes they end up running away and don't want to act with what would be best for them, which would be if we have a great hospitality, if we listen to our guests, if we help to serve the right portion at the right time and give them the right sleep or advice on how to do so, we would have much better quality time. And I think this is what we really want, is to have like thriving people, not just surviving people. We want people to live and thrive, not only survive. And giving them the guidance, but we're not always good at it, and we sometimes scare people so much off that they run away, and that's not the point. So if we can develop healthcare systems that are much more accommodating, that would be, I think, a great achievement. And luckily, we see this concept of health literacy that stimulates this kind of action, trying to get to know what people understand about health, but also that they understand what we really want them and to help them and get the right actions, taking medicine in a proper way, following the guidance by the staff, and so forth. So this is a shared responsibility, not only a responsibility of the individual, but of all of us to create that stewardship about health and well-being.
And I absolutely love how you put it in using the story, and just makes me think that when you think about the big picture, how complex it is, because then you think about the different health systems that you have around the world. What are the real incentives behind that? And when it comes to volume versus quality, right? And there's this discussion of moving to a value-based systems and how it to be working. So it's way more complex than that. But when you think that, most of the people, they can't really get a full hour of quality time with the doctor, and the doctors don't have the resources and the time that they need to actually listen and think deeper and have time and do the right way. So it starts getting too complex, right? And so I just don't want to make it too complicated, because at the end, we're talking about simple things and the small things and the things that we can do, that are more available to us. What do you see are some of the global challenges and regarding the health literacy? And I know it's too much. When we think global, it's too much, but maybe you have some good cases to share, or maybe you see some common challenges throughout the world. Can we cover that, Kristine?
Yeah, I'll try. So I think one challenge we have is that many regard it a personal problem, a personal challenge, and it's the patient or citizens that don't understand what to do. But in fact, when you scale up, as you mentioned, and we realize that, for instance, in the US, one of the big healthcare providers, United Health Group, they said they could actually cut away 1 million hospital visits that are not necessary if either the person understood that this was not needed right now, or could be postponed, or should have happened a month earlier because of a certain issue, or the healthcare providers didn't have to call in as many appointments because it was sometimes based on a structure saying, oh, this patient should come every 6 months, but actually every 6 months wasn't really necessary. It was just like a routine or a habit. It would fit for some, but not for all. So there's certainly, when you scale up all those visits, it's a lot of resources that we spend in ways that are maybe not the best for our healthcare system, and not even the best for our patients. So there are new thinking of how to look at the patient's needs. Some use like a traffic light system with red, yellow, and green patients. So the green patients who are actually knowledgeable and know when to call in case of an emergency. They are the green patients in a portfolio of, for example, a general practitioner, and they don't need the same kind of information as those that are more at risk, the yellow group, or those who really need help and guidance and much more time, and that would allow the general practitioner to then give that patient much more time if it was not filled up with green patients that might be the worried well and don't really need to be there as many times as the one in the red group. And sometimes it's not the patients who take those decisions. It's really a management decision on how we, again, design our pathways, our patient journeys. So that's just one example.
Yeah. And Dr. Raquel, what are your thoughts?
I think that we are progressing in terms of seeing, first listing all the fields that health literacy can be applied to several problems. And so more recently we had this concept of institutional health literacy besides personal health literacy, right? And the way we can provide health literacy is very it's very diverse. We have like as healthcare institutions, we have health literacy in terms of promoting health, in terms of preventing diseases, in terms of taking care of health conditions, and it's so much to do in such a short time, right? When we have this interfaces with patients, that only counting on health institutions, it's very dangerous. So we have to empower patients to be more independent and active in terms of searching for the knowledge and learning from their peers. And it's actually very interesting because I'll tell a story to illustrate. I have a 9-year-old son, and when he was around 6 or more, maybe 7, and he was, we were getting out from the pandemic, and he started to play soccer, and he was very interested in running faster. And for, I don't know why, like the YouTube suggested me a video from BBC News that were saying that beet juice were helping athletes running faster. So I was very happy because he doesn't like very much vegetables. And I said, you're very interested in running faster. So beet juice can help you. Would you like to try it? And said, well, Mom, that's awesome, but no, thank you. And 2 weeks later, one of his best friend's mother called me asking me the recipe for the beet juice. And I said, I don't have the recipe. And she said, but your son is drinking. And I said, no, he's not. But he said, he's drinking to my son, and now my son wants to drink. So this social validation, right, is very powerful for good habits, right? It's just like a story to illustrate the power of the communities. In this case, the community of children in a classroom, in a soccer team, and how they can make good influence and among themselves. So sometimes we as health providers are only trying to see what is good practice and distinct good practice from bad practice in terms of this change in health knowledge and wisdom. I would say wisdom sometimes, because there is so much health wisdom that we as health providers are not aware, right? I usually say that I learn a lot from patients, and I think we have to be sometimes humble to see that, right? And try to promote this social wisdom. And it's and what Professor Kristine usually says, it's about empowering people, right? Health literacy by design encompasses this concept of empowering people to promote health literacy.
Following that line of thoughts and social validation, super important point. But we have the other side of the story, which is misinformation in health literacy, right? And do you find it more challenging now in the age of digital media, because now people have access to all sorts of information from everywhere, and as much as you have the good side, which is using the social validation, you also don't know where people are actually getting their information from. So Raquel, and I believe that's one of the foundations of your startup as well, right? So could we cover that? And then I'd love also to get Kristine's point of view regarding this information as well.
Okay, so the first thing is that we often say that too much information is not so good. And sometimes I question that, because there's so much to be communicated and we need a lot of information, but we do need that information to be curated. So one of the fundaments of health literacy is that the person who's assessing this information can discern between valid and not trustable information. So building trust is a huge challenge for governments and for health institutions. And sometimes it also is related to this fact that, okay, doctor, you live in a world that is not the same as the one I live in. How can I trust that you have the best information, the best knowledge to know what is best for me, right? So the what we try to do in my startup is to make people talk about health. And we as health providers are just separating the good news from the bad news, right? So I'll give you another example. I have when I was a kid, my mother used to draw a little face with a match in the banana, so we could enjoy eating fruits, right? She would make some nudges for us to consume more fruits, and that is a very valid health tip. But some people would say that, I have a brilliant tip to make kids love fruits. You just soak the fruit into sugar, right? So my whole in this situation would be, okay, the banana tip, drawing the face in the banana so we can bite the banana, is valid. The one with the sugar, not valid, right? And it also will bring information that is very consistent with environments that are not usual for us. I'll give you an example. I have a lot of patients that have to get a transient or permanent tracheotomy, right? And when we tell them how to take care of this tracheotomy, and sometimes we just don't figure out that this patient may not have treated water in their houses, right? And it happens. Brazil is a huge country with diverse scenarios and with a lot of poverty too. So sometimes it's better for us to a patient in a poor context in terms of resources teach another patient. The patient that is poor in resources but are actually managing well their tracheotomy would be probably the best person to teach another one. How can I know what it is like to deal with that in a context of very poor resources, right? And only after building trust that we can actually be able to fight misinformation. Also, misinformation do use a lot of science in terms of digital and social influence, right? They do use conspiracy theories. They frame the information in terms of what people are more willing to accept. And they don't have much to lose, let's be honest, right? So building trust and actually using the science-based strategies that unfortunately we learned from quackeries and anti-vax movements. Let's use their weapons, right? Let's use the same strategies that are backed by science to inform people the best way, right? And let's make them copy behaviors, right? So if I know that my neighbor is getting vaccinated, I am more willing to get vaccinated because I trust the neighbor, right? So let's show that people like them are getting vaccinated, and that may somehow shape their behavior.
Great. Kristine, what are your thoughts on that?
I'm very much in line with Raquel. I think regarding the use of the internet, for me, it's been kind of a blessing that it exists. It is my highway to knowledge and empower myself. But of course, there are also those who are manipulating people's naivety, and that's a shame. And that's where I do hope that health literacy will help mediate the impact, because if people have the health literacy, they would know to ask the right questions. They will judge whether this is right for them, whether they can trust this kind of information, or it might be too good to be true. But we also unfortunately know that when people are searching for prolonging their lives or finding new treatments when they have maybe heard that they have cancer, there are lots of people who want to abuse them in a vulnerable situation. And this is where I believe that experts can help them discern the information, like Kel, I think you do every day with your patients when you're, they've been asking Dr. Google, and then you help them filter through. But also, as you mentioned, the peer education. And I think this is where internet makes a big difference, that now patients can get engaged in Facebook groups, for example, or with like-minded people, where they can get tips on how to live with a certain condition. And these are kind of tips that we as health providers and healthcare professionals can't give in the same way as those who live with a certain condition 24/7, 365 days of life. We see them in a short moment of time, either as part of treatment or as part of research. And the last thing I want to mention is that when we communicate, I think we have an obligation to also make that information accessible on the internet. And thinking like old school newspapers, you have a headline, you have like a blurb telling what the story is about in a bit more detail, and then you have the full detailed story. And I think this is a way we can help communicate in a very easy way with a bit more substance to it, and then all the details, so that those people who are ready to read the full story, they also get the full story, not only the headlines, because that might not be enough. But those who cannot comprehend the full story in one go, they might go to the little blurb or the headline. And I think in that way we can help still to have people digesting that information overload that you mentioned at the very beginning of this program.
So, from those researches that you've been doing, Kristine, is there any country maybe, or any organization that do you see as a good case that we could be looking deeper into, that they were able to somehow establish either processes or benchmarks on health literacy that you could share?
Yeah, we saw from the European perspective that making a European survey in 2011 has made a big difference for the whole discourse of health literacy in the region. Having that baseline data set with 8 countries, and now it's I think 17 or 19 countries, and it's being expanded, gave decision makers and healthcare providers an opportunity to discuss the findings. And we saw that on average 1 in 2 had difficulties in finding, understanding, judging, and using information to take decisions. And that came as a big surprise politically. We think we have good healthcare systems, good educational systems, and good welfare systems in Europe. And still, we were faced with this health literacy public health challenge. I reckon that those countries that really dived into it and decided to find solutions for it, they have also seen progress. And some of them even adopted health literacy or a promotion of health literacy as a political goal in their national health plans. And we saw it also filtering through to, for example, national cancer control plans. So having a national health literacy strategy influence a lot of other policy areas like vaccine strategies, cancer strategies, diabetes control, and so forth. And moving then to Latin America, in Brazil, you are actually one of the front runners. There is already a national network in Brazil on health literacy. We are having next week our Global Health Literacy Conference, and there will be a delegation from Brazil regarding publications on research. You are front runners, so I think you can be proud of yourself. I think there is a reason also why it fits into your mentality. You're open-minded. You want to, secure health and well-being for your population, for your healthcare system. You are really people who are very passionate and driven, like I hear Raquel here. You want to make a difference in everyday life for your patients, for your community, for your institution, for your country. And it's interesting how health literacy is like a bug. It's contaminating. This is the stories I hear from health literacy champions around the world. This is why I think I'm also traveling to spread the message, because it kind of gets into you. It's very difficult to de-learn, because it speaks to human rights, it speaks to equity, it speaks to dignity. And it goes the way we treat our patients or the people we work with, but also these are the values we want to scale up to national level, to regional level, and to world level. So I'm really happy and grateful and privileged to be here today to speak with both of you, because I sense you have this that passion, and I'm pleased to hear all your stories.
Kristine, believe it, it's our honor, right, Raquel? But one of the things that when I was just listening to your story about how in Europe you did this research and started measuring, and how 1 in 2 people felt difficulty. So first of all, it shows us how data is important, and how being able to have the metrics in place, and how when people get struck by that, and then you see this need to move. And it also reminded me of this story that Raquel once shared, that how we think that, talking about health literacy, you think that you're talking about people that don't have access to information, and it's the other way around, right, Raquel? I don't know if you're going to remember exactly the data, but how the most percentage of people actually come from a good quality of life, and they actually have access to information, right?
Yes. We usually say that we usually associate health literacy with literacy, right? But if I'm not wrong, in United States, I think that 3/4 of the people who have insufficient health literacy and below, they are actually in the private health, right? We sometimes we think that poor health literacy is only a problem that is faced in among unprivileged populations. And I do have a dual practice. I used to see a lot of public health patients. Now I'm only in research at Hospital das Clínicas, but I do have my private practice where I can see patients from more privileged backgrounds, and I do see a lot of them with limited health literacy, like spending a lot of money in treatments that are not useful, like not diagnosing diseases that could be like diagnosed before, and arriving with advanced cancers and other problems that could be treated in a more initial stage. So that is not a problem only among unprivileged patients, and it's actually very costly. Right? It's very costly to the health systems, right? It is estimated in America that almost $230 billion are spent every year, like they are wasted due to poor health literacy. And if nothing is done in the further generations, we're going to be facing a waste that is already in trillions of dollars. That's like, it's impossible to be sustainable. No health system can be sustainable with such a waste of money, right? And in the same time, investing in health literacy is very cost effective. We have like growing research that are showing us that it can not only increase quality of life and life expectancy, but also decrease costs, right? And there are some initiatives. There is a very nice revision from Maastricht University, right, that says that the return of investment in health literacy could be from 0.6 to 27 euros per euro invested in health literacy. That is a very powerful ROI, right? And also we would have like social return of investment, like up to 7 euros per euro invested, because like the problem is very important. It is very costly, and I usually say when something is very bad, the little you know can produce like impressive results. And I think it is more than time that we focus our strength. That we focus our efforts in providing health literacy, even if we don't have all the science behind, even if we don't know all the ways that health literacy can be better provided. We should make decisions right now, right? We should be more proactive and learn while we run, right? While we are making interventions in health literacy, we must learn the ones that are more effective, the ones that are more costly. But we do have to take action right now. We are already late in terms of taking action to provide health literacy.
Yes, definitely. You know what? When I was preparing for this conversation and having you both with us today, the list of questions that I had was like, I knew that it would be impossible, right? Just to cover in an hour. And I see that we are already getting out of time. And so what I'd like to do, and this was not planned, but I'd like, Raquel mentioned in the beginning of the interview how she's been following and reading Kristine's studies, researches, and publications. So, Raquel, would you like to ask Kristine a question?
Yeah, I'd love to. There are many.
You have to choose one, it's 5 minutes now.
Okay. Kristine, what do you think is the low-hanging fruit in terms of action to produce impact right now in terms of health literacy?
I think it's what you said in the very beginning, that we now recognize there is something called health literacy. You said it's there and we do it every day, but we didn't call it a name. And I think now the baby has a name. And if we can promote that baby and see it growing, that would really make a difference.
So, Kristine, what would be your message like to our listeners that are interested in knowing more, in learning more? Which should be the way to go? Which is your advice?
Yeah, as I said, recognizing the term health literacy would be a big step. And I will be honest, I didn't know it either. I had studied medicine. I didn't complete my degree as doctor because I shifted to a career in public health, but I did a bachelor of public health. I did a master of public health, and I had never heard the term. So we are somehow challenged by also translations of health literacy into other languages, and in some languages it's called health skills or health competencies. And I think that gives a hint that we definitely are moving beyond just knowing, as you also said, Raquel. So having the skills, the competencies to act and take care of your own health and be fit both in body and mind, and take care of your family, of your community, then I think together we can move the curve, so to speak, because health literacy is everyone's business. And literacy indicator is not enough. Social determinants are not enough. There is something here called health literacy. And when we put those indicators together, we can make a big shift. And that's our common challenge. And I'm happy we're facing it together and can help build that change that is needed.
Awesome. What about you, Dr. Raquel? Any final message?
I love to see that more and more people are being touched, contaminated by the health literacy issue. But as a surgeon, I'm always worried about, okay, where should I act? And of course, I do a lot of acting in the individual field. So, for instance, when I explain for a patient how it's going to be that we are going to remove their thyroid, and I try to use the most the simplest language as possible. Like I always do those tactics, like ask me three questions, or teach me back, and so on. So, but that is in the individual context. But I'm also worried about how can we expand that, because in Brazil we have a lot of patients that have very difficult access to healthcare and to health information, despite a public universal health system. So how can we make the ground for them to learn from each other, regardless of the health practitioners and regardless of the health system? So how can we empower them to not be so dependent on the healthcare systems, right? So that's the provocation that I want to leave people with.
It was absolutely wonderful to have you both with us today. Thank you so much. And, I hope we'll be able to cover and to spread the word. And that's just the very beginning. So I'm wishing you both the best. That's surely a challenge that is worth, keeping informed, and each one of us doing our part. Thank you so much. Thanks, everybody, for listening.
Future Hacker. Life. Path. Future.